Smiley Morning Show, 12 before the top of the hour, y'all. Hey, we got the one and only Dr. M.J. Collier with our COVID-19 update. Dr. Collier, good morning.
Good morning, Rickey, Smiley. We got some great information for you on the coronavirus. As you know, we are in a free fall. Cases are surging in the United States now with 2 weeks ago, 8 states were increasing their cases. 1 week ago, 15 to 18 states. And as of now, 31 states have increased rates, now exceeding where we have been from day one. So we have regressed. We are back to square one. And 2 months of quarantine in place has really, the benefits of all of that have been lost at this time. So ICUs are at capacity in a majority of states now. And people, even though the death rate is still lagging, the morbidity rate, i.e. people that are sick and having disease processes and will have chronic health problems after corona infection are increasing. So we are just in a free fall. But we got some good news, Rickey.
Okay.
One, if you've seen the lines on the television, they talk about people waiting in line for 8 hours to get a test. Now, there's been a big step, a breakthrough in testing. They have announced that they have now an on-site test that is a professional test. It's not an at-home test. It's done by doctors, professionals, but can even be performed at the pharmacy. This test is based on antigen treatment, and it's a standard nose swab or a throat swab, and what it tests for are antigens of the virus. So the gold standard, of course, is the polymerase chain reaction test, which looks for virus genetic material. So that's still the best test to get. But this one is a rapid test. You can get results in about 10 to 15 minutes, and it's done on a standard swab. So it received FDA approval yesterday, and so now it's going to be widespread and be using. So instead of people having mobile testing and not getting their results now for sometimes up to 2 weeks, people will be able to get results in 10 to 15 minutes, and that should change the game a little bit as to how we are responding to this virus, because testing is key. Now, the other thing is treatment, though. So people are doing better. The death rates are improved because we've learned a lot about this virus. We've learned not to put people on ventilators as quickly as we had been, that people can tolerate a respiratory challenge, and the things like positioning them in the prone position, i.e. laying on their stomach, will help improve aeration in the lung function. But we also have learned that this virus is a masquerader. I've had at least 2 patients whose predominant symptom was GI with, nausea, vomiting, diarrhea, and this one patient put it explosive diarrhea. And this patient had been to the urgent care, had been to the emergency room. Nobody tested them for corona. They came to Dr. Collier's office. We tested them. They tested positive. Now, one is responding well to conservative treatment, rest, and self-quarantining. The other patient, unfortunately, is in ICU right now on a ventilator. So it can go either way. Both of these individuals are young. They're young people. We're not talking about individuals that are in their 60s. So a company called Regeneron announced that they have a breakthrough in treatment now, this antibody cocktail. And the great thing about the antibody cocktail is that it immediately treats an acute infection. In other words, if you're already sick with the virus, you can be treated. And it also protects you from the virus. This is the type of breakthrough that we have needed. And while we're waiting on a vaccine proper, this will probably be utilized with and along with vaccine therapy to help get this under control. But that therapy is now in phase 3 trials that started June 1st, and it's shown great results in human trials, and the safety studies have also been well. So the antibody cocktail specifically treat the coronavirus only. A lot of the medications that are repurposed that we're using now, causing, they're just doing symptomatology.
Right. Hey, on the other side, we got 2 phone calls for you, Dr. Collier. Y'all, okay. More Dr. M.J. Collier coming up next. Rickey Smiley Morning Show.